So there's been a lot of talk in the news lately about a recall of a breast implant, and I think it's important to understand what is being recalled and why it's being recalled, and what exactly that recall means. So let's start by teaching you about different kinds of breast implants. All breast implants have a surface, some of which are smooth and some of which are textured. This is an example of a smooth implant, this is a textured implant. The recall affects only textured implants of one particular brand, and in the US there are 3 brands of implants that have texturing. Again, the recall is only for the Allergan brand of textured implants. The reason the recall is happening is that there is a very rare type of blood cancer called Anaplastic Large Cell Lymphoma, abbreviated ALCL, that's been found in a very small number of women with textured breast implants. As of earlier this month, July of 2019, there were a total of 573 cases in the world of that type of blood cancer. And of those cases, more than 83% of those cases had this particular brand of textured breast implant. So the FDA has recalled them, and what that means is that they're no longer going to be sold in the United States. That does not mean that any woman who has this kind of implant needs to run to their surgeon to have them removed. Now let's talk a little bit about how that blood cancer can present itself. So Anaplastic Large Cell Lymphoma, ALCL, is again quite rare. Even with this implant, the risk is probably 1 in 3,000, whereas for breast cancer, the risk for a woman in her lifetime is about 1 in 8. So the risk of developing a breast cancer is much higher than developing a risk of ALC or developing ALCL, even if you have this kind of implant. Women who develop that condition will typically experience swelling in one of their breasts. This can happen years after surgery and for no apparent reason. And so if you have breast implants and one of your breasts swells, you should see your plastic surgeon for evaluation. Women who had the ALCL diagnosed were found when their breast was swollen to have a pocket of liquid around the implant, and that liquid contained the cancer cells. The good news is, even when diagnosed, ALCL associated with a breast implant is curable, and the treatment for that is complete removal of the implant as well as the internal surrounding scar tissue called the capsule around the implant. So it is a definitely treatable condition. Again, women who have breast implants, the current recommendation is do not go and rush and have your implants removed. They should only be removed if there's evidence that this condition has developed. If you're not sure about what implant you have, I would start by looking through your records. Typically women are given a little card at the time of their surgery that explains what kind of implant they have, and if you need help figuring out whether you have one of the recalled implants, you could certainly look at that card. Again, the brand is Allergan, and the implant would be textured. If you're not sure if your implant is textured, you could speak with your plastic surgeon and they'd be able to help you with that. If you have any questions and you're just not sure, or you don't have your implant information, the best thing to do would be to contact your plastic surgeon and see if they have those records of what kind of implant you have. But again, don't lose a lot of sleep over the recall. The vast majority of implants in the United States are smooth implants, and even those women who have textured implants, there's only one of the 3 manufacturers that's currently being recalled because the risk of that condition with Allergan implants has been shown in the research to be significantly higher than the risk if you have a different brand of implant. If you have any questions, I'm happy to talk with patients. You can call our office at 708-524-1400 or visit us at our website, which is plasticsurgeryofchicago.com. Thanks a lot.